Hi, Dr. Pelto here. I want to go over the 5 keys to prevent your plantar fasciitis from kicking up again. So I wrote down a few notes here in my little journal here because I had a patient that come in the other day, and they had plantar fasciitis and it came back, and they're wondering why in the world did it go away and then 3 years later it came back. So specifically for this patient, it was because of the tight muscles in the back of the calf. That's one of the aspects we'll talk about, is continuing to loosen the back of the calf. Number one, the reason it comes back is people don't treat the underlying cause of the plantar fascia, specifically the back of the calf. So the equinus, or the tightness in the back of the calf, needs to be treated. It's usually with foam rolling, something like a night splint or a Strasbourg sock, kind of and then sometimes some physical therapy, and I ask my patients do a morning stretch as well. So I have a little routine that I recommend for patients. Also, you have to control the pronation and the strain that's going through the plantar fascia, and this is usually done with an orthotic or a very good shoe or an UFO sandal. And then you also need to deal with the thickness. If there's thickness in the fascia, which is seen on ultrasound, then you have to deal with that. You have to break up that thickness, and that's with shockwave therapy instead of using like a cortisone injection. So number one would be treat the underlying cause. Number two would be avoiding quick fixes. Many times people go to a doctor and they're going to give them a quick fix. They're going to give them a cortisone injection, and then they don't go back. And I find that cortisone sometimes works, but I find many times after about 4 weeks, the pain comes back and you have to do another cortisone, and it doesn't really do a great job at healing the fascia. It does a good job at reducing the inflammation only in that area. So avoid anything that anyone's going to offer you a quick fix. Number 3 reason that comes back is people wear bad shoes or don't wear any shoes, and they're doing a lot of walking. So a lot of walking wearing flip-flops, just a lot of walking around. You have to be careful because shoes can get old and they're not going to give you as much cushion. Number 3, be careful for overuse. So many patients are overusing it. Doing a lot of walking, increasing more than 20% in a week is overdoing it. So like they go to Disney and they do a lot of walking, or they increase their mileage or doing a lot of outdoor activity. That can really cause things to flare up. And then finally, patients don't have the tools. I think that it's good to have some tools at home. A couple of things that we recommend would be UFOs. I recommend a belt or a TheraBand to stretch in the morning. I recommend a orthotic or insert in your shoe, or a good stable shoe with an insert, and also UFO sandals. I really like those. I recommend those a lot. And then, so if something does come back, you might want to seek out a doctor to help you with that. Okay, so those are some ideas of how to not have plantar fasciitis come back.